Thank you for that kind introduction. So I'll be talking today about the state of the art update on PrEP implementation in the UK and European countries. So I'm employed at ECDC and I have no conflicts of interest to declare. So this is the outline of my presentation. I'll start by giving you a brief update on the epidemiology of HIV in Europe and Central Asia. I'll move on to put PrEP in the context of the Sustainable Development Goals. I'll focus most of my talk on the status of PrEP implementation in Europe and finish off by saying a few words about some operational guidance on PrEP that we are currently developing. So we do joint HIV surveillance together with WHO Europe, and this is the figures from our latest report last year. So in 2018, approximately 142,000 people were diagnosed with HIV in the wider WHO European region. 16% of these cases were diagnosed in the West, 5% in the center, and a full 79% in the eastern parts of the region. At the bottom of these bubbles, you see the rates per 100,000 population, and you see in the eastern parts where the rates are much, much, much higher than in the center and the West. So this is where the burden of HIV is in our region. So looking now at the modes of HIV transmission by subregion, when we look at the West and the center, the modes of transmission are very similar, where approximately 50% of all diagnosed cases occur among men who have sex with men, followed by heterosexual contact, and only approximately 4% among injecting drug users. Now, in the eastern parts of the region, this differs very significantly, where the main mode of transmission occurs among heterosexual men and women, followed by injecting drug use, and only 5% among men who have sex with men. Another big difference in our region is this issue of migration, where approximately 50% of all diagnosed cases in the West occurs among migrants, here defined as those who are born abroad. In the center, that falls to 10%, and in the eastern parts of the region, only 1% are born abroad. Looking at the EU specifically in terms of HIV diagnosis, we're starting to see trends in all modes of transmission. And what I want to point out is this blue line where we're starting to see a decline now over the past couple of years among men who have sex with men. This is very promising as they account for a significant proportion of cases in our region. Now, we don't see this decline in all countries in the EU. It's mostly these 10 countries that we are seeing decline. So we're trying to understand now, what are they doing right in terms of combination prevention, and how can we learn from those 10 countries? Looking at the proportion of HIV diagnosis among MSM and migrants, you see on the left-hand side that MSM account for 52% of all diagnoses in the EU in 2018, and migrants account for 42% of all diagnosed cases. So these are the two most important groups in terms of HIV diagnosis. And if we are going to achieve HIV epidemic control in the EU, EEA, we must scale up interventions targeting MSM and migrants, and this is where PrEP comes in. So I just want to put PrEP in the context of the Sustainable Development Goals. You're all aware of these goals. Goal number 3 is about health, and goal 3.3 says that by 2030, we should be ending AIDS. Now, UNAIDS have been tasked to define what it means to end AIDS, and they've defined it as 0 new infections, 0 AIDS deaths, and 0 discrimination by 2030. To achieve these targets, they've developed so-called fast-track targets that by 2020, they want to see a reduction in new HIV infections to fewer than 500,000. They want to reduce AIDS-related deaths to fewer than 500,000 and to eliminate stigma and discrimination by 2020. So for Europe, we have specific targets. Those targets are relatively clear when it comes to incidence reduction of a 75% and to the so-called 90-90-90 treatment target. When it comes to PrEP mortality and stigma, there are no specific EU targets. For PrEP, UNAIDS want to see 3 million people globally on PrEP by 2020, but we don't know really what that means for Europe, and we're trying to work with them to try and identify that. So this is our latest report. It's an evidence brief on pre-exposure prophylaxis implementation in Europe that was published in November, and I'm going to share some data with you around this now. So this shows you the status of formal PrEP implementation in Europe as of today, actually, or today when this recording was happening in 19th of October. As you see here in dark green, we see some countries that are where PrEP is made nationally available, which means that it's reimbursed by the government. In some lighter green countries here, we see there are ongoing pilot and research projects. And in the lightest green shade here, we're seeing countries where they are making generic PrEP available, not fully funded, but to an affordable price, anywhere from 20 to 50 euros a month for the end user. And in blue, we see here where PrEP is actually not formally implemented whatsoever. And you see a clear west to east gradient where many countries in the western parts of the region, they have made PrEP available, whereas in the eastern parts of the region, no implementation whatsoever. This shows you some data from 2018 showing the numbers receiving PrEP in the last 12 months per 100,000 adult population. So in the blue bars, you see those who are receiving PrEP at least once in 2018. Out of those, you see the red squares, those who are receiving it for the first time in 2018. And what this shows you is that a high proportion of those using PrEP are using it for the first time in 2018. So scale up was actually happening in 2018. We assume that this number has gone up. We haven't got data for 2020 yet. We will be collecting that shortly in the next couple of months. And in parentheses, you actually see the actual numbers receiving PrEP in each of these countries. So we ask policymakers as well, what is limiting or preventing the implementation PrEP in your countries? And not surprisingly, the issue of the cost of the drug itself, as well as the cost of service delivery, as well as limited technical capacity are those issues that are preventing PrEP implementation in many countries. So let's address this issue of cost. So in 2019, in April, we hosted a meeting here at the ECDC where we invited countries to talk about PrEP. And one of the things that came up was this issue of cost. So we asked these 23 countries what they are currently paying for 1 month's tablets of PrEP purchased by governments. And as you see here, there's huge variation in our region where we have one country A on the left-hand side, which is paying 850 euros for 1 month of PrEP prescription. And country W on the right-hand side is paying 325. The medium cost is 176 euros per month. Now, this is in 2019, and I know that PrEP prices are coming down, and we'll be monitoring this going forward. Just quickly, I looked at this data. We can't really identify which countries here are which. It's kind of sensitive information, but I did look at this information. And if you see here country A and compare that to country T, these are two neighboring countries in the EU. Both have publicly financed healthcare systems, very similar. Country T has a slightly higher GDP per capita and a higher health spending per capita. So it's a richer country. They spend more money on health. Yet country A pays 850 euros per month for PrEP and country T 19 euros a month for PrEP. So it doesn't really make sense how these prices are set, and countries really need to figure out how to reduce the cost of PrEP going forward. Now, hard data around number of people using PrEP is difficult to come by. So we've partnered up with Hornet, which is a gay dating app, a global gay dating app, and we've done a couple of studies with them to try and understand this. The latest one we did was in 2017, and I'm going to share some data with you. So we produced a fantastic paper on the results of this study, which I'm adding here for your information. So we had more than 12,000 respondents from all 55 countries of Europe and Central Asia, and we got all these respondents in a matter of days. So it's a very effective way to get data from people using PrEP. So one of the first questions we asked was, how many people are taking PrEP? Are you currently taking PrEP? And as you see here, 10% of respondents said that they were currently taking PrEP. Then we wanted to understand, where are you taking PrEP? Because in 2017, PrEP wasn't really formally implemented in many countries in Europe. So where are you getting PrEP? And as you see here, 34% said they got PrEP from their doctor, 30% said they got it from internet. So in the green colors, we would classify those people as getting PrEP formally, and on the left-hand side, in red shades of color, those who are getting PrEP informally, either through internet, through a friend, through using post-exposure prophylaxis as PrEP, or through other means. So this is, of course, a real concern because we want to really have people using PrEP formally, otherwise they're not going to be monitored. So we asked these people, does your doctor currently know that you are taking PrEP? And as you see here, a third of respondents said no, they haven't told the doctor that they're taking PrEP. And of course, that is worrisome because they're not being monitored appropriately then. Another thing we wanted to understand, is there a demand for PrEP in our community? how likely are you to use PrEP in the next 6 months? And out of those currently not on PrEP, 22% said they would be very likely to use PrEP in the next 6 months. A significant proportion said they didn't know, and 35% no, they did not agree with this statement. Out of those currently using PrEP, the vast majority said they would continue to use PrEP in the next 6 months. So there is a clear demand for PrEP in our communities. Briefly, some results from the EMIS study, the European Men Who Have Sex with Internet Survey study that was published in 2019. They had some questions here around PrEP, and I'll share some data with you around this. So one of the things they asked for all these respondents, 125,000 people across Europe and Central Asia, have you ever heard about PrEP? And as you see here, 2/3 said yes, they had heard about it, but almost a third of respondents didn't know what PrEP was. They've never heard about PrEP. So that's a significant proportion. Again, you see the color on the map, a clear west to east gradient, whereas men in the west are more likely to have heard about PrEP compared to those in the east. So this shows you that approximately 3% of respondents were currently taking PrEP daily or on demand. Again, a huge difference. In the left-hand side, you see countries, UK, France, and Belgium, where more than 6% were currently taking PrEP. And on the far right-hand side, 0% in Moldova and very few percent in Belarus, Serbia, etc. So huge discrepancies. Again, looking at the likelihood of using PrEP if it was available and affordable, you see here that approximately 44% of respondents said they would be likely to use PrEP if it was available to them. 27 were not sure, and about 28% said no, they were unlikely to use PrEP even if it was available to them. So based on this data from EMIS, we partnered up with them and worked on this paper to try and estimate what the PrEP gap among MSM is in Europe. So this shows you, again, what I just showed you before, the percentage of EMIS respondents currently taking PrEP daily or on demand. And if you compare that to the percentage of EMIS respondents who would be very likely to use PrEP if it was available to them, we are able to produce this gap estimate. So again, looking at the top right-hand corner, we're focusing on those 22% or so in dark green, only those who would say they would be very likely to use PrEP if it was available to them. So it's kind of a conservative estimate. So here we see on the left-hand side, the gap of those currently on PrEP and those who would likely be using PrEP if it was available to them is 44% in Russia, and that drops to 4.3% in Portugal. In the EU, where we have data from all countries, 3.2% were currently taking PrEP, but more than 20% said they would be likely to use PrEP if it was available to them. So here we have a 17% overall PrEP gap in the EU. So what does that mean in terms of numbers? So based on these estimates, we estimate that approximately 500,000 men who have sex with men who want and need PrEP in the EU are currently not accessing PrEP. And of course, this is of concern because the longer the delay in access to PrEP for these men, the more HIV infections will occur among them. So we need to scale up PrEP implementation in our region. So just to finalize, saying a few words about some operational guidance on how we are supporting countries in the EU. So we started this project earlier this year to try and develop operational guidance. The objective of this project is to develop some very basic minimum standards and principles for PrEP service delivery. We wanted to develop a standardized monitoring tool for PrEP to support countries. Many countries wanted us to draft a policy brief on to try and make the case for PrEP for policymakers, and that's something we're doing. And then also we're collecting these country case studies where we're asking 16, 17 countries to share their experiences with other countries where PrEP is still to be implemented. And we are finalizing this guidance as we speak and expect to publish this in the first quarter next year. These are the so-called 10 core principles of an effective PrEP program. I'm not going to go through all of these 10 principles, but I just wanted to highlight them here for you and say that each principle is described in this guidance with the supporting rationale for why it's included. And for each of these principles, we have a related minimum standards for delivery are presented. Once these minimum standards have been met, we really recommend that countries are more ambitious and develop country-specific targets. So in this guidance, we'll be going through each of these 10 core principles in more detail. So to conclude, formal PrEP rollout has been slow, especially in the eastern parts of Europe and Central Asia. As a result, there is evidence of significant informal PrEP use across European countries. Due to the slow formal rollout, a significant number of men using PrEP informally are doing so without informing their sexual health providers, which is of great concern, because that means they're probably not being monitored appropriately. There is a significant PrEP gap in Europe. In the EU alone, we estimate that 500,000 men who have sex with men who want and need PrEP are not accessing PrEP. And clearly, there is an implementation gap when it comes to women, trans people, migrants, and people who inject drugs. Most of the people that are accessing PrEP formally today are men who have sex with men, not people from these other groups. And as I said, we are trying to support scale up of PrEP in Europe by developing operational guidance that will be published in the first quarter of 2021. I just want to finish by acknowledging and thanking colleagues at ECDC as well as consultants that have been working with ECDC to develop this presentation. Thank you very much.